So today we're going to be conducting the skin, head, hair, nails, and lymph node exam. During this exam, we're going to make sure we always, again, wash our hands, introduce ourselves, obtain accurate vital signs, and perform a general survey. So to do an accurate skin exam, it's all about exposure and making sure your patient is comfortable. So when I'm doing my skin exam, I'm going to be noting any kind of pallor, cyanosis, jaundice, which is any kind of yellowing of the skin, rashes, bruises, lesions, dryness, erythema, which is redness, and any ulcerations. So again, with proper exposure, do you mind if I lower your gown just to look at your chest?
Okay.
I like to start upper body and then lower body. So doing all the inspection and palpation in the uppers and then moving on to the lowers. So I'm just going to be looking down here to the chest area. Perfect. I'm going to be looking at the upper extremities. I was already able to look when I pulled down the gown, checking all the way down. Since we're touching the upper extremities, I'm always going to be looking at the nails. For the nails, I'm looking for any kind of color and shape, and noting any deformities or swelling. And for the upper extremities and the chest, we're looking at the body hair as well for color, quantity, and distribution. We come around to the back of the patient. The gown is open. And while I'm doing the upper part of the body, I'm looking for any skin lesions. If I do see any, I would appropriately measure them. So if I look at any lesions or moles are over 6 millimeters, let's make sure we measure them. And then we use the A, B, C, D, E criteria to make sure that nothing is concerning, okay? And if I did notice any kind of moles or lesions, we want to make sure we're palpating them as well, meaning we're touching them. Perfect. So I'm going to actually also assess the temperature of your skin. Again, I do everything in the uppers and then everything in the lowers. So I'm just going to roll up your sleeves. And you only have to measure the temperature on the distal portions of the body. So just the uppers and lowers. Using the backs of my hands, I'm going to be touching for temperature and moisture. Excellent. I'm just going to put the hands as well. We can assess turgor. So I'm going to gently pinch the skin, pull it up, and see the elasticity of the skin, and that's assessing for the hydration status. So if we're a little bit dehydrated, the skin could tent up and stay like that a little bit. So let's look at the bottom. So I'm just going to expose your legs here. Do you mind if I move all the way up? So we're going to be looking at the anterior thigh. I'm going to remove your socks. I'll do it for you. Down here.
Oh, thanks.
Okay. So looking at, again, any kind of lesions, all of the discoloration or findings. Would you mind standing up for me? So you want to make sure you're looking at the back of the legs as well. And again, assessing with the backs of my hands for temperature, moisture, and even tenderness as well. You can sit down for me. And just like we assess the nails up here, we want to make sure we're assessing the toenails. Again, for color, shape, swelling, and deformities. And then I always look at the bottom of their feet. You can really check out any kind of ulcerations, especially in diabetic patients, and looking between the toes, making sure we're not missing anything. Underneath. Perfect. All right. So now that we kind of did an overall skin screening, I'm then going to focus on the head. So I'm looking for size, shape, and symmetry. And any evidence of trauma or infection. I'm looking at the face for any involuntary movements, expression, or swelling or edema. I'm noting the hair, the color, the quantity, and the distribution. And you always want to make sure you're looking at the back as well. I'm going to feel the hair for texture. So I'm going to be touching your head. And what I'm feeling for is any kind of brittleness or excessive oiliness, which could be concerning. I'm going to palpate, which means I'm going to touch your scalp and kind of just press around. Let me know if anything is tender. So I'm feeling for tenderness, any kind of lumps, even kind of any depressions as well. Perfect. I'm looking at the skin. Perfect. We're next going to palpate the temporomandibular joint. big fancy word for the joint right, where your jaw connects right in front of your ears. Do you ever have any tenderness or clicking in that area?
No.
So I'm gonna press with the palm side of my fingers. Would you mind opening and closing your jaw? Perfect, one more time. And kind of do a gentle circular motion, and you're feeling for tenderness or clicking. Then move your fingers behind the ear, right to the mastoid process, kind of that bony prominence right behind the ear. And we're feeling for any tenderness as well. Excellent. And because in our face we also have sinuses, we want to make sure there's no tenderness along the sinuses. So you have your frontal sinuses here and your maxillary sinuses here. I'm going to gently press on them and let me know if you feel any tenderness. Any tenderness there?
No.
And gently push up on either side. And now if my patient did have tenderness or was complaining of any kind of upper respiratory congestion or swelling of the face, we could do something called transillumination of the sinuses. And what that is I'm going to use my otoscope, make sure it's on. I'm going to ask the patient to open up their mouth. I'm going to shut the lights off. And I'm going to shine the light through the maxillary sinus. And if I can see it on the roof of your mouth, it means there's not fluid in there. If there was filled with fluid, I couldn't really see the light. So open up as wide as you can. Would you mind looking up towards the ceiling? So we're going to gently put it here. Perfect. On this side as well. Excellent. So I can see the light all the way through to the roof of the mouth. So there's no fluid obscuring that light. So next we're going to move down to the neck. We're looking for symmetry, swelling, any kind of scarring. We will be assessing range of motion and any kind of palpation when we do the MSK and the neuro content. So we're just going to be observing either side, making sure everything looks symmetrical on either side as well. Perfect. So while we're at the neck, we're going to do the lymph node exam. So there are 10 lymph node areas. There's the preauricular, which is right in front. So I use, again, the palm side of my fingers and do a gentle circular motion. So I'm palpating for size and tenderness. And when I was inspecting the neck, I was actually looking at the lymph node areas for any kind of swelling as well. So after you do the preauricular, postauricular, I come down to the tonsillar, the submandibular, right at the angle of the mandible, the submental, right under the chin. I'm going to come around the back of the head and palpate the occipital. That's kind of right at the base of the skull. We're going to lift up your chin just slightly. The anterior cervical chain, I use about 3 fingers. And we move down all the way to the clavicle. The posterior cervical chain, which is right behind the sternocleidomastoid, on either side. The deep cervical, so I'm actually going to kind of bring my fingers underneath the sternocleidomastoid, and you're putting a little bit more pressure. Again, all the way down to the clavicle. Do you mind if I bring you down a little bit? We're going to assess the supraclavicular and then the infraclavicular. Excellent. So that's the cervical lymph node exam. We're then going to look at the epitrochlear and axillary lymph nodes. So I'm going to bring your gown up just a little bit. It might be easier sometimes if your patient's comfortable with it to expose their upper extremities. Do you mind if I bring down your gown? Thank you. So the epitrochlear lymph nodes, we're looking again for swelling and then palpating for size and tenderness. Relaxing the arm really does help because the epitrochlear is kind of right just proximal to the elbow and you're going underneath the bicep. And again, just gentle circular motion. Perfect. Because the axillary area can be really sensitive, I like to do those last. I'm going to be putting my fingertips kind of in your armpit area, okay? I'm feeling for any kind of swelling or lymph nodes, so we're going to go in the center. And then we're going to kind of go underneath the pectoralis right here. You have to make sure you use a little bit of pressure to get underneath that muscle, and then posterior, kind of right in front of the latissimus. Excellent. And the same on this side. I'm trying to relax your arm, I'll hold it up. Relaxing it just relaxes all the muscles in this area as well. So again, going up the center, coming to the front, under the pec, and then posterior, right in front of the latissimus. Excellent. Now to assess the inguinal lymph nodes, I'm gonna demonstrate laying down. Now this just has to be verbalized. It does not have to be actually done during the exam. I'm gonna have you lay down. Don't forget to bring out the table to support your patient's legs. So you would be actually going right where the ligament is. So you're gonna actually be using the palm of your hands, going down. There's two chains. There's the vertical chain, which kind of goes down into the groin, and then you have your horizontal, which kind of goes down the anterior thigh on either side. So you look for swelling and then palpate for both sides and tenderness as well. Don't forget those on your patient, okay? Thank you. You can sit up. And that's it.